All right, good morning, everyone. It's 11 a.m. and the Texas Early Learning Council is called to order. I'm Reagan Miller. I'm the chair of the Texas Early Learning Council, and I want to welcome all of the council members, staff, and public who are also joining us today. We're presenting this as a Zoom webinar. Council members and staff that are present today are participating as panelists, and members of the public are participating in listen-only mode. Megan Schneider, our Interagency Deputy Director for Early Childhood Support, will serve as today's meeting facilitator. And as we do every meeting, we want to remind everyone, please mute your devices. And if you forget, Megan may also mute you. Also try to remember to state your name each time before you speak. The deadline to submit written public comments closed yesterday at 5 p.m. You may still request the opportunity to provide oral comments, and Megan will put instructions into the Zoom chat. So if you're interested in making a request for oral comments, please take a look there. All right, our next agenda item is to welcome new members. One of our new members was not able to make it today, but I want to let everyone know that Tori Lee, who is the Director of Early Childhood Education with the Texas Education Agency, has been appointed by the governor. And so we look forward to working with her on the council. And next, Maricela Nava, I hope I got that right, is also our new member, filling the role vacated by Teresa when she resigned. So Maricela, are you on the line, and do you want to introduce yourself and tell us a little bit about your background?
Good morning. My name is Maricela Nava. I'm the director of the Texas Southmost College Early Childhood Program here in South Texas. As an advocate of and for young children, I am really grateful for this opportunity to join the Texas Early Learning Council team. I am truly looking forward to being part of this committee. And again, I want to thank everyone that made this possible. I have actually been in the childcare industry for about, I'd say, 34 to 35 years already. So I consider myself kind of like a seasoned employee or advocate, if you'd say, but I'm definitely very eager to continue to learn with you all and make everything possible for our little Texans here in Brownsville and our region. So thank you again.
Fantastic, Maricela. All right. We're going to move on to our October 2022 minutes approval. So if all of the members will take a look, it's either in your email or it was attached to the calendar invitation. And I want to see if anybody has any edits or changes to the draft 2022 meeting minutes. And if not, I'll request a motion to approve the October 2022 meeting minutes.
Reagan.
Hello.
Oh, go ahead, Julita.
Julita McDonald. I move a motion to approve the minutes.
All right, Julita has made a motion to approve. I'd like to request a second to the motion.
This is Kim. I will second.
All right, Kim Coffrin has seconded the motion. If there's not any discussion, then I'm going to turn it over to Megan to conduct a roll call vote of the Early Learning Council members. Megan, over to you.
Great, thank you, Reagan. When I call your name, council members, please reply for, against, or abstain. Catherine Abba.
For.
Sarah Abrahams.
Abstain.
Weldon Beard.
For.
Terry Breeden. April Crawford.
For.
Rochelle Daniel.
For.
Alferma Giles.
For.
Melissa Hoisington.
Abstain.
Becky Huskehler.
For.
Kim Coffrin.
For.
Tori Lee. Jerletha McDonald.
For.
Reagan Miller.
4.
Maricela Nava. And Maricela, if you want, since this is your first meeting, you could just say abstain since you weren't here at the October meeting.
Abstain.
Stephanie Rubin.
4.
Amber Scanlon.
4.
Kirsten Schwab. June Yateman.
4.
And Audrey Young.
4.
Great. The motion to approve the October 2022 meeting minutes has carried, and we met a quorum during that during the meeting minutes. Reagan, I will pass it back to you.
All right, great. So agenda item number 4 is public comment. And as I mentioned, if you're interested in oral comments, please take a look in the chat. Megan is going to facilitate our public comment section.
Great. So as those of you who tune in regularly know, earlylearningtexas.org does have a section of the website called meetings, which has all the meeting information for past and upcoming meetings, as well as the agenda once it's released. And we do try to put public agendas up a minimum of 1 week prior to the meeting date, along with instructions for submitting public comment. We did receive one public comment request in advance, which is Kate Hoffman. So Kate, you've been here before, but I will still read all of the instructions for awareness. So please share your name, your organization, and the agenda topic that you'll be commenting on. You will have 3 minutes to provide your public comment. And when you hear a chime mark at the end, that means, or at the 2-minute mark, that means you have 1 minute left. And so work group members will ask you questions afterwards if they have any. And I will now promote you to a panelist so that you're able to unmute and talk, and feel free to start once you're over on this side of the Zoom.
Great, thank you so much. Good morning, everyone. My name is Kate Hoffman, and I am here today on behalf of Early Matters Dallas. And thank you for the opportunity to provide public comment related to agenda item 4, which is the Early Childhood Data Roadmap Work Group, as well as the interrelated agenda item 5, the Preschool Development Grant Birth to 5. We provided full written comment yesterday, but today I just wanted to highlight a few quick points while we're all together at this meeting. So Early Matters Dallas remains highly supportive and very, very grateful for the thoughtful work and resources that the Early Learning Council has invested in exploring an integrated data system. And we've been continually engaged in the work of the work group over the past year alongside our other Early Matters partner regions. And this is really stemming from the fundamental belief that integration and coordination of data in early childhood is essential to informing both local and statewide policy and programmatic decisions. And so now that all of this hard work has been in place for the past several months, we really just wanted to make sure that the council was taking into consideration 4 different things as you're thinking about making sure this ESIS development is impactful and sustainable beyond the PDG grant and the next few years. So the first thing that we think is really important is just thinking through the initiative's oversight. The draft roadmap talks a lot about developing data governance plans, but beyond that, I think it's really important that there be a decision made very quickly to articulate who exactly is the lead of the project and that there is some transparency around that. I think that the draft talked maybe about a lead agency being designated, but even so, we think that it would be even more effective if there was a singular individual with the authority and the resources to move the ESIDS project forward, obviously working closely with the rest of the agency and the interagency work group. But wanted just to put out there that to really see this project through, we need to have one person who is thinking about it and moving it forward in an efficient manner. And then also wanted to bring your attention today to different parts of the roadmap's timeline and task prioritization. Just given that we are in a legislative session, it is important for any legal barriers to be identified now and data sharing agreements to be developed very quickly, or at least started over the next few months, so the legal teams can figure out if there needs to be any statutory changes while we have that window. And then third was stakeholder engagement, as we're learning more and more things every day with the roadmap draft and the PDG grant submission coming out. We think it's important that there are more opportunities for stakeholders to engage in providing feedback. In particular with the roadmap, we believe that advocates could be particularly useful in providing feedback on data literacy efforts, as well as how the PEAMS assignments could be used for various research questions over the next few years. And we look forward to quarterly stakeholder calls or other ways that we can engage. And then we just have a lot of questions about budget and resource allocation, as I'm sure many others do too. It didn't seem like there were a lot of details on that. And so we want to make sure that there are adequate resources allocated both throughout the PDG and then in the years to come, and think that there should be more transparency around that, so that if things are needed, we can rally and get the support that is needed to make sure that this is seen across the finish line. So as you all are moving from kind of the exploration phase of ESIDS to the execution phase, we really just want to be supportive and involved and look forward to future conversations. Thanks so much. Happy to answer any questions.
Any questions? Megan, do we have any more public comments?
We do not. No further requests came in prior or just now.
Kate, I do want to thank you for those thoughtful comments. We're putting a lot of work into thinking through this idea of an ESIDS, and so we certainly appreciate the time that you guys are taking as well to think through the issues that need to be considered. So really appreciate you being here.
No problem. Thank you. We're excited.
Okay, and if we don't have any other public comments, then we're going to move on to our next agenda item, which is an update on the PDG federal grant. I'm going to turn this over to Kathy Arwood from TWC, as well as Megan, who will share some additional information about what we heard in the PDG listening sessions and on the state's application. So over to you guys.
Good morning. This is Kathy Arwood with Texas Workforce Commission. So we are excited to announce that we did receive $16 million for the first year of the PDG Birth Through 5 renewal grant. As a reminder, the project cycle is 3 years, and it started December 31st, 2022. So we will basically have each calendar year, and grant activities will include updating the Birth to 5 needs assessment, updating our statewide strategic plan, maximizing parent and family engagement, the piece we're excited about, supporting the Birth Through 5 workforce and disseminating best practices, supporting program quality improvement, and then sub-grants to enhance quality and expand access. We'll be talking a little bit more about what we'll be doing there. The next slide, Megan. And just a reminder of the purposes of this Birth Through 5 renewal grant. We have, given the changes that have occurred, in every industry, but particularly in childcare with the COVID-19 pandemic, one of the big issues that we're considering is how those changes have affected the childcare industry and investing in strategies that will address those needs. Also, supporting and strengthening the early childhood care and education workforce, enhancing quality, expanding access to early childhood services, and then, again, creating those seamless early learning experiences from birth through 3rd grade. And I'll turn it over to Megan.
Awesome. Thank you, Kathy. Megan Schneider, Interagency Director of Early Childhood. As a reminder, we did share this slide back in October when we were in the thick of the application process as kind of a preview of what we were planning to submit. So wanted to dust it back off and put it in front of you because this is what we went with. Nothing changed drastically in terms of the high level buckets. So we'll talk a little bit about each of those buckets and what will be included in them. But across the top of this slide, you see the goals, which are all from the 2019 preschool development grant initial funding that this council helped to oversee the needs assessment and especially the strategic plan for. These were those 6 strategic plan goals that continue to guide our work. So as part of this new round of preschool development grant funding, we'll have the opportunity, like Kathy mentioned, to revisit both that needs assessment and that strategic plan. So these goals could change, but for the purposes of the application, this is what we anchored the work around. And so those initiatives that you see there align to various different goals, but they all fall across these different buckets. So connecting families to services, as well as engaging families as leaders, you see that across the bottom because that's important across all of the different aspects of the work that we're going to be doing. Supporting local systems building, expanding access to high quality programs. On the right there, you see both strengthening and building the early childhood care and education workforce, which aligns with that 5th goal of a well-qualified early childhood workforce with the right support and training. And then on the far right is that work around integrated data. So the state having a strong underlying data system to support a high degree of collaboration, which corresponds with developing a statewide early childhood integrated data system, or as you've heard already today, that acronym thrown around of ECIDS. So we will dig in a little bit to each of these today and then definitely have lots more information coming. And before we go any further, and I forget to do this, I just want to say a big thank you to both the council members as well as members of the public who are listening in. We did hold a series of listening sessions with council members kind of in smaller groups. And I think almost all of you took the time out to attend those and really provide thoughtful feedback. And then members of the public, I know we did a few different avenues for just broad scale listening sessions. That input and feedback was so helpful and important. It helped to guide the application, and it is also something that we will be using now that we got the funding, just to make sure that we're trying to align what we're doing with what we heard from all of you. So to do a little bit of a click down into those different buckets, we've grouped the connect families to services and engage families as leaders. Those are somewhat distinct, but that work really does go hand in hand. So in that bucket, we do have plans to expand the early childhood interagency website that we launched back in the spring of 2022, which is earlychildhood.texas.gov. We knew when we launched it that was version 1.0 and that we wanted to iterate on it and make it an even better resource. So the plans to do that will be first to build it out further so that it has more regional content and local content. Right now, it's really a kind of state level blanket resource. So wanting to drill it down a bit further so that it can be as helpful as possible for folks on that local level to connect, because oftentimes the services someone needs are not something you'll find through TEA, for example. It's something you'd find through your local education agency. So trying to tailor that resource. So that's, I would call version 2.0. And then the next phase of that work around earlychildhood.texas.gov will be to build a tool, which is will be an eligibility screener. So helping to orient families to which of the various different early childhood education programs they might qualify for, particularly across free public school, pre-K, and childcare scholarships or subsidies, as well as Head Start or Early Head Start. So, and then pointing them to, based on what you said, these are the types of programs these are the programs you might be eligible for, and pointing them to the right place to apply for them. So that's that first bullet. The second is to equip both our state agencies, so the member groups of the Early Childhood Interagency Work Group, as well as local organizations with best practices for both family strengthening and support, and doing that through high quality materials that already exist out in the world, and getting access to that type of training. So we'll be doing that at the state agency level, and then we'll also be providing sub-grants to support family engagement activities more at the local level. We will also at the state level be building on that knowledge and understanding to co-design some sort of ongoing feedback mechanisms for families to be guiding our state efforts, particularly the efforts of the implementation of the preschool development grant. So that's that first bucket. The second bucket is support local systems building. So that is going to center on the amazing work that's being done through the Department of State Health Services and the various affiliate communities that are already part of Help Me Grow, building on that Help Me Grow success that we've seen and helping more local communities and coalitions to help to adopt that Help Me Grow system framework. Through, again, technical assistance as well as subgrants to local communities. And there will be kind of layers of options. So, full Help Me Grow adoption all at once isn't the right fit for everyone. Some opportunities to kind of piecemeal that out to work towards that full adoption and readiness. I will say for those two different local subgrant opportunities that we mentioned, just given the timelines that we're under and the structure of the funding, we will be working with groups that already have some kind of a contractual relationship with the state entity so that we can get that funding out within the required timelines. And then that third bucket down there, expand access to high quality programs. So this is a mix of a lot of different things, kind of building on some of the great work that we've been able to do, funded through Texas Workforce Commission stimulus funding. So the first is continuing funding for the child care regulation navigators. So within HHSC, there's a handful of new positions who are navigators helping to orient folks through that process of applying for and getting licensed. So continuation funding for that. And then supporting young children with disabilities or delays through screenings and services. We know that there's been a boom in service requests for early childhood intervention following the COVID pandemic. So helping to equip those providers and contractors with the resources they need to try to meet that demand. And then continued funding for the training, ECI training of childcare providers on things like developmental screenings. That third bullet in that last bucket, expanding access to research-based classroom assessment and coaching in pre-K settings. This is work that'll pick up more in years 2 and 3 of the grant, but building on some of the success that we've seen with similar models around providing high-quality research-based mentoring and coaching in pre-K settings. And then the last is around expanding infant and early childhood mental health consultation support for workers in the early childhood care and education system. So we've heard loud and clear that that is a big need, and we've seen some really successful regional or local efforts. So part of the work in the first year will be conducting a landscape analysis and an implementation science overview of what that infant and early childhood mental health consultation world is like in the state and nationally to inform the work over years 2 and 3 of the grant cycle. And I will pass it back to you, Kathy.
Thanks, Megan. So I will cover these next 3 buckets. Strengthening and building the ECCE workforce. We're very excited about work we're doing, and this is collaborative work with TWC and TEA on developing a pipeline of effective early childhood educators and professionals. And we're really looking at high school to career and whatever that means for the individuals that are entering into early childhood education, whether it's through, going directly through from high school to career, and then, achieving a CDA credential or going into to an apprenticeship. Also, folks that are either going directly from high school to associate's degree or bachelor's degree, or maybe they're already in an ECCE career and then decide to pursue their education, further their education, and move into CDA, associate's degree or bachelor's degree. What this looks like is really an increase in scholarships from TWC. We're going to be changing some of our scholarships to be able to include high school students who are enrolled in a dual education program. We will be working with some of the institutes of higher education to develop articulation agreements and transfer agreements. Also supporting, high school students and also college students that are going to school full-time rather than working full-time in an early education setting, which is what we've, traditionally funded. This would include funding their tuition and fees and also practicum training so that they do get that work-based learning, paid work-based learning along with their education. So we're really excited about it, and you'll hear more about that soon. We're also going to fund incentives to grow and maintain qualified therapists workforce for young children in ECI, early childhood intervention. We know that it is difficult to maintain their workforce of therapists, particularly in rural areas. So this funding will help support recruitment and retention bonuses and whatever's needed to maintain that workforce. So that will be incredibly helpful. Also, and again, this would be more in year 2, but offering that restorative discipline coaching in a pre-K setting. So this offers support to early educators for alternatives to suspension and expulsion. Then in the second bucket, develop statewide integrated data system. I know we've already heard about that. Thank you for that great comment. And then I believe we're going to be hearing more about that, so I won't go into it, but it is what it says, right? Statewide integrated data. So we're excited about furthering that project that we've already been working on. And then finally, reports and studies. So as I mentioned, we'll be updating that birth to 5 needs assessment. Again, we know that a lot has changed since that initial needs assessment was conducted in 2019. So rather than updating the current needs assessment, we're going to start fresh and do a full needs assessment for 2022. Additionally, we are going to update that strategic plan. And when I say update, I really mean we're going to start again right fresh, because since the needs have changed, our goals are going to change. We know some will be the same, but many will be different or have different activities to reach those goals. So those of you who were around in 2019 probably remember the strategic planning sessions that we had, and we'll be following a very similar process. And we're hoping to have some really great input on strategic planning that's going to include the input that we received from our needs assessment. So I know we'll probably talk about it more later, but we will be having presentations during TLC meetings on the results and findings of needs assessment as it's ongoing, to help us get data sooner as we develop that strategic plan. And so I know that it's going to be great. Looking forward to that. Hopefully we'll be able to support in-person sessions as well. So I think that is it, and I'll pass it back over to Megan. Thank you.
Ooh, y'all, that mute button was so buried. I apologize. So we'll close out our little PDG, preschool development grant update by saying you as Texas Early Learning Council members will be key leaders and partners in this entire process, particularly around the strategic planning that'll fall in this later in this calendar year. So like Kathy mentioned, we will be feeding updates kind of in a regular chunked approach for the needs assessment that will guide the strategic planning. And so the evaluation partner that we'll be working with, who will also be leading the needs assessment, is Dr. Dorothy Mandel and her team, including Kathy Buick at the University of Texas, Tyler, as well as population health in the UT system. So she will be has a really thoughtful approach to how we're going to make sure to be sharing information so that we can be informing that strategic planning as we go. That said, the next meeting of this group, we just have these as quarterly meetings, and so we know that that won't be enough. Just the April and then the remaining 2 meetings we have for 2023 will not be enough. So I'll be reaching out to y'all as we are figuring out the details of the 2023 timeline to get some additional dates around presentations about the needs assessment output, as well as strategic planning sessions. So super excited for that. And then the last piece is that as part of all of the work that we're getting to spin up, we do need some extra hands to help get that work done. So Texas Workforce Commission will be hiring for 2 new positions. And Department of Family and Protective Services will be hiring for 2 new positions. So that's 4 positions total. And we will definitely be sharing as those job postings are up, be sharing those out with y'all. Would love your help in helping to get us some really awesome folks to help do this work. So I hope there are lots of questions. We will pause there and would love to field whatever you have.
I have
Questions?
a question. Oh,
Sorry, who was that?
Jerlitha.
Jerlitha McDonald.
Okay, Jerlitha.
So I have a question, and thank you, Kathy, for the update. My question is in regards to, it says that therapists will be provided for young children. I want to know, will the practitioners, the early childhood workforce, have access to those therapists? If not, is that something that we can consider adding therapists also for the early childhood workforce?
Jerlitha, are you asking, is that in relation? I'm going to go back a couple slides. Is that in relation to?
Oh, go back.
This
Right.
one, qualified therapist workforce?
Yep.
So that is specific to early childhood intervention, the therapists that ECI has that work with young children. I do think part of your question is getting at, I'm going to go back another slide, is getting at what we might call infant and early childhood mental health consultation support, which could be kind of any mental health type intervention that's needed. That's something we don't have funding explicitly to have those folks available in year 1, but it's something that we're figuring out how can we do that effectively as a state on an ongoing basis that's not just one-time funding. So no, but yes, that's on our radar and it's something that we want to figure out how to do.
Okay, thank you.
Great question. And I will say, I think part of the reason we're not getting a lot of questions is that we were just able to share the full grant with y'all. I think it was on Wednesday, as well as kind of a summary overview. So I know many of you are digging through that, and we look forward to digging more into all of the details with you going forward.
I think the next question was from Stephanie.
Okay, thank you. So first of all, thank you to TWC and the ESIDS members who I know spent several months working on the application, and convening members of the public and the Early Learning Council. I know it was a lot of work and we really appreciate that and very excited to get the renewal grant. My question. So a couple of things, of course, we love about what it's in the application is obviously there's lots of system improvement proposals. There's the data piece, but there's also some financial support for certain things like incentives and, support for ECI in certain ways. And so that's great. I was wondering, I haven't read closely the whole application, but I wonder if there's a way to share with the council, like, what portions of it have a cost and what that is, because also in the future, if we want to sustain these things, it would be good to know what the how much will go out the door in sub-grants and other things in an easily accessible way. And if I just haven't seen that, you can just point me to the page. And then the other thing I wanted to note was that there's ESIDS, the data work, there's inclusion of the eligibility screener on the website that exists now that seems to be focused on early learning programs specifically. But the PDG, unless I'm incorrect, it kind of leaves out, other than developmental screening, like healthcare and health access. And there's also, obviously good outreach mentioned in there, which is to support the outreach workforce in some agencies like childcare, licensing. But what I don't see in there is HHSC's access and eligibility, which is also really important to make sure that, kids and families have the health coverage and healthcare they need as another kind of service and program that they might be eligible for and may need to sign up for, including not just healthcare, but other things as well. So I don't know if that's something we can continue to talk about in our sessions as we talk about priorities for the Early Learning Council that may go beyond this specific application. But I do think, it's very important to think about the health and well-being of kids as important part of school readiness. Of course, David Fagan will talk about that a little bit with our dashboard. So I wanted to just see if those were discussions we could continue to have. And also, as we're talking about data integration, if we're leaving out a whole slew of important data at HHSC, that will be a big gap in our early childhood data system to leave that out. And I do know people have had those conversations. I just wanted to note that as part of the council.
So Steph, I think these are all things that can be discussed. I think that, I think what you have to start somewhere and then you can scale it and grow it. So I think these are, I think a lot of the stuff that's in there are certainly things that can be scaled in future years. So at least kicking things off and getting started, understanding we're certainly not where we want to be at the end. Those are my thoughts. I'm happy for any of the other folks to jump in too.
I mean, I realize what you're saying, Reagan, is of course, we know from the ESIDS work that this is a process. That's a lot of negotiation already with the existing agencies that are participating. And of course, adding in, behemoth HHSC, or at least access and eligibility, is maybe another future step. So I wanted the council to understand as they review this, and are thinking about health and well-being, we have some work to do to make sure that the recommendations around early childhood and school readiness don't leave that out in the end, like of our planning and needs assessment, because those are obviously very important to family well-being and kids' well-being.
All right.
Thank you.
Thanks, Stephanie. Catherine.
Thank you. Also, congratulations on the team for being awarded this grant. It's a huge accomplishment, and I know a lot of work went into it. And thank you for soliciting our opinions and feedback and comments. I just have one small thing to say. I'm really happy to see, of course, the pipeline of early childhood educators from high school to a career as a priority. I would just mention one thing for consideration. What we have found since COVID, perhaps the last 2 or 3 semesters that our capstone, which is our internship class, all were hired. So in the past, it was a problem where students had financial difficulties. They were having to do internships at centers and not being paid and having to leave jobs in order to complete their degree. However, we have not had that problem in the last 2 to 3 semesters because centers are so desperate for personnel. And probably there are center directors here who can attest to that. So obviously, this is anecdotal based on Houston Community College, and I can certainly pull other community college educators, but this might be a consideration as you look at the funding for that and the model of how you might support centers with funding. Just wanted to mention that. And
Thanks,
thank you.
Catherine. I think those, yeah. I'm glad you're sharing that. I think that's one of the ideas of this pipeline project. I mean, which is why we've thought about how do you start in high school? Because there are opportunities for kids in high school to also do some practicum work actually in the classroom. So, you know, hopefully through a thoughtful process, we might be able to help address some of those workforce challenges through a more robust and deliberate pipeline. It's exciting for those students to hear that they're all getting hired so quickly.
Yes, even before they graduate. I mean, it is good. And I'm glad they are being paid for their internships. It's deserved.
Yeah, that's exciting. It reminds me of, gosh, back in the days when the oil boom was big and people kept getting hired from their training classes before they could even finish because people were desperate for workers. So now we're seeing it in childcare. All right. Okay, next to Becky.
Okay, mine's sort of related in a way. I was just wondering about the paid workforce place learning. And of course, you know, I teach at a 4-year institution and the majority of our students are transfer students. And whether they're from the birth through 5, because we do have 2 birth through 5 programs, which just got NAYC accredited, which I'm very proud of. And then we also have an early childhood grade or pre-K grade 3 certification and whatever, but it's from my experience, it's the students in the certification realm that have to drop, you know, have to go alternative certification or whatever to be afford to do student teaching. Okay, because they can't afford to take off. And this is something that's of real interest to us at the university is how we can have get funding for, we have a preliminary apprenticeship type of program where they do get hired, but that needs funding. So I'm wondering how if this can be extended to students in the early grades, like birth through 5 or the certification, like the pre-K 3 group who are at the end of their program and they have to take off work, you know, to do their practicum. If they're in childcare, they can't do it there. They have to do it in public school. So that's another whole aspect. And I know this is mostly on preschool, but a lot of the things now are extending with the EC3 or pre-K 3 certification, like the TEACH grants and things are also being able to be extended into those people teaching in the early grades. So getting their teacher certification. So that's one of the things my question was, how do you see that working? And I still think that funding is needed because as they're getting, and also funding for salary, because oftentimes these students get their bachelor's degree and they up and leave childcare because they can't get the money that they can get in public school. So that's another whole types of things. So that's my question a little bit more, if I'd like to hear a little bit more about the paid workplace learning, what your thoughts are on that.
Kathy, do you want to respond? We do have some stuff in the grant and I think Kathy can talk about it.
Sure. Yes, that was something that was important to us, that if we are going to have a student working at and you know, in the grant we have those students would be connected to a Texas Rising Star provider to work. We have both teacher stipends, which I don't think we mentioned earlier, but we want those teachers to be supported as well when they're providing that education to students. But then also for the student, you know, we want them to be paid at a rate that's commensurate with the pay in that area for the work that they're doing. And yeah, so they will be compensated just as any other worker in the field. Did that fully answer your question, Becky?
So it's mostly just, it is people that are working in TRS centers that this applies to, right? People that are in working, that are employed already. Aren't they employed already? Or are they, you're talking about people that are placed in a center? We have that too. The students are not currently working in a center and they're placed in a practicum for practicum in a child development center, TRS or NAYC or whatever accredited center. And then they don't get money unless they're there as a regular employee. So you're saying that it's the people that are being placed in TRS centers that, you know, that they're not currently working there will get the stipend. Is that correct?
That's correct. So if they're not currently working and they are placed in a workplace learning, and you know, so to be clear, they could be working there, but not full time. And for their practicum portion of their work, they would be covered by this funding.
Okay.
So, we're not providing, you know, I think it's something that helps both the provider to be able to have that additional support in the classroom, and also helps that student to, you know, to be compensated for the work that they're doing, even while it's part of their education program.
And they can't, like in our case, they can't be doing anything that they're getting paid for currently. So like say if they are a classroom teacher, I mean, you know, this is different than I guess, because they're already a classroom teacher, they can't get paid to do the thing that, you know, for the practicum credit for doing what they're already doing. So I guess this is people that are outside that and you're placed in a center, but they're getting paid. So, okay, thank you.
Thanks.
Thanks, Becky. And we'll have a lot more discussions on this with you guys. Those of you who already have experience in the classroom and with practicum. So it's our first overview, but much more to come. So good questions. All right, next up is Amber.
Hi, thanks so much for taking my question. And again, congrats on this really great work. It's really informative. So my questions is around the systems building part of the PDG grant, and forgive my lack of knowledge in some of these areas, but it stems around the goal of early childhood programs in Texas aligned to ensure children are ready to learn by kindergarten. That is a big, huge, thorny goal. We certainly see that in North Texas, and it varies metro by metro, city by city, county by county, as we all know. And that being such a big goal as it relates to, what slide number is this? I don't know the slide number, but under support local systems building, under activities 1 of 2, broaden Help Me Grow Texas through technical assistance and subgrants. For such a big, huge, thorny goal, my question is, there just doesn't seem to be a lot of action items on this slide, and maybe there are more in other places. You know, Help Me Grow Texas obviously is a great tool for families and parents to connect, you know, children and families to services, but that's not necessarily going to impact making sure that early childhood programs are aligned in a way that every child is ready to learn by kindergarten. So my concern / question is around systems building, which from where I sit is one of the biggest needs we have in early childhood in North Texas. Yet the discussion here with the resources from the PDG grant, I don't know if the description is just more vague or there's more to come, but just based on this document, it doesn't seem to really address that. So that's my question.
I think it's a great point you're raising, Amber. I would say that for the purposes of slidifying, that's not a word, but taking the details of that 67-page narrative, you know, and giving you all this overview today. There's definitely a lot more depth and richness around that support local systems building that I think isn't getting reflected in this one bullet. So agree that this description here is probably not doing justice to the thorniness and the bigness of that goal. I think that that's something that we will definitely be digging more into in future conversations. So would be happy to address that. I don't have a simple answer, but I would say, yes, you're definitely right. It's not a 1-for-1 of like, if we do Help Me Grow Texas, automatically everything's aligned and kids are kindergarten ready. But recognizing that it's one of the pieces to kind of get us towards that. And this, I think you're picking up on what I think is probably one of the most complex and sort of hairy sections of all of the work. So there'll be lots more to dig into there.
Okay, thank you so much.
Yeah.
All right, and Kim.
Good morning, everybody. And again, congrats on getting the PDG. It's a great day in Texas that we get this extra funds to do some of the things we've been dreaming about for a while. Couple questions that will come to no surprise to anyone that I'm asking or pointing out or putting on record. One, I think as we go through this process over the next 3 years is just making sure we are holding ourselves accountable to those goals as we get through the process. So just making sure that we are being accountable to ourselves and where those goals are and what we want to do. And then the second point is really to that pipeline into that early childhood workforce. The pipeline's great. We need the pipeline. We need to fix some of the things that we've all talked about. But as we build into that strategic plan and think about our needs assessment strategic plan, compensation is going to get raised. And we've got to be ready to have that conversation and think big and make some bold asks and set some good goals for us as Texas. So that's all.
Thanks, Kim. I will also, and I want to point this out to everyone, this was a 16 million, that's only 16. Lots of, so.
I wasn't expecting compensation to be fixed with 16 million, but we have an opportunity to develop a strategic plan to include some of those things, to put on record for where those need to go and what things that we can start doing and start thinking about. And we've got an opportunity. So I just don't want us to pass that up.
Thank you. All right, Amber, did you have another question? I still see your hand up. I just want to make sure. All right.
Sorry about
Sarah,
that.
do you have anything? I thought I saw your hand up.
Yes, let me unmute. So, hey, Sarah Abrahams from PEI at DFPS. And I just wanted to follow up and maybe clarify a few things that Amber had raised, and also recognize, like Megan said, this slide was meant to be very high level. And I think there's lots more in the weeds and working out to do. I do think, I mean, the supporting local systems building is definitely a part of this PDG application that PEI specifically has been fairly involved in. And I think I just want to mention two things. One is, you're right that the Help Me Grow framework by itself is not the one answer to all systems alignment at the local level for Texas, but we do think, and I think have already begun to make an investment among our early childhood coalitions at the local level around sort of lifting up the Help Me Grow framework as a very useful structural tool for local coalitions to sort of think about what kind of impact that they could have locally, and what are the kinds of elements of a local systems that we think will have the most impact on that kind of overall family and child success path. I think this investment through the PDG grant is really about helping us do some capacity building at the local level for those coalitions in order to both improve readiness and connection to that Help Me Grow framework. And specifically, it's a part of the ongoing evaluation for the PDG work, so that we'd be working with Dr. Mandel and her team as a part of the overall PDG grant to better understand, when we support local coalitions in this way, what is the kind of impact that we can measure? When we support local coalitions in this way, what is the kind of impact that we can measure? Knowing, like Reagan says, that this, while $16 million feels like a lot, we're really trying to take on quite a bit, and that stretches all these resources. So in some ways, we're really using these dollars to better understand where we can maximize that impact at the local level and how the state agencies can best support local coalition building work. So I just wanted to clarify, like, yes, this is very high level, but I do think there's both some behind the scenes structure building and also very intentional evaluation support that is connected to some of this systems building work.
Thanks, Sarah. Becky, did you have another question? You're on mute.
No, I accidentally did the lower hand thing, so sorry.
Not a problem, not a problem. Okay, I am not seeing any additional hands up, so I want to make one more opportunity for anybody who has questions or comments on the PDG. Let me also say, as we're closing this out, we are in the process of creating a web page at TWC for the PDG grant, so that we can push out a lot more information about the grant, about the activities that are underway. So I know Kathy and Megan are working to pull that together because we know there's a lot of interest in this. And so we want to make sure that we have a way to keep that webpage updated. So you'll be able to find information there. And I think we're hoping to have that up and running in the next few weeks, early February. Obviously, the webpage information will grow as the grant gets implemented. So just want you guys to know that that is coming.
And I will add on to that, Reagan, and just answer one of the questions that came in through the chat from one of the attendees, which is a great one, was how do I get more information by email, like versus just push information about this? If you're at this meeting and you registered for it, then we have your email. And so that's kind of our distribution list is anyone on this call or who attended these meetings in the past. So as soon as things like that website or app or other information comes available, we will push it out to your inbox.
Perfect. Okay. Anyone else before we move along? Okay. So our next agenda item is the Early Childhood Data Roadmap Work Group. And so we're going to hear from Sarah Abrahams on the council's work in this area. I think you all know that we put together this work group. A reminder that all of this work group's information is posted on the council's website. So Sarah.
Hey, thank you. And it's interesting because while the ESIDS and this data integration is such a important component of our PDG application, this work actually started way before we even submitted this application. So it's a little bit of a stars aligning here. But in April of last year, the Early Learning Council formed this Early Childhood Data Roadmap Work Group, the longest name for a work group ever, to begin exploring sort of a possible early childhood integrated data system, which is ESIDS. That's the way that we generally say that acronym. And I think the goal for this group, which the members are listed here, was not necessarily to say how we would do that or even to create a fully developed plan for that, but was really to look at other state examples to really understand what was an ESIDS, how would we define it, how do we articulate the reasons why we would need something like that, the specific ways that we would use data if we could integrate it in a more intentional way or share data among agencies. What exact data do we already have available, and what things do we think we would need to build or change in order to create this kind of integrated data system? What kinds of questions are we trying to answer in the first place? How can we even really be clear about why we want to do this, and what kinds of things we think we would need to what this would accomplish? So throughout the remainder of 2022, We met together as a work group. We reached out to stakeholders. We did lots of focus groups and individual interviews. We met with folks from all of the representative state agencies to better understand how their data systems work now and what data they had access to, what was publicly available already. So we are right now in the final stages of that review. The work group has, I think, finished the draft of all that information into one place, and I think we're at the point right now where we're sharing it back with various stakeholders and state agencies to ensure the accuracy and correctness of the information that we have included. And I believe that we are slotted to really dive more deeply into this in our next TELC meeting, where we'll be able to share the full data, the full ESIDS roadmap that came out of that work group meeting, and also the development of an early childhood data landscape, which is really a very in-depth and comprehensive review of each state agency and the kinds of data that are currently available, so that we can do a little bit more of a detailed crosswalk. We intend for this ESIDS roadmap to guide the work that is connected to the PDG implementation, although in the first year of our 3-year PDG grant is really around these ideas around consideration of design, consideration of the legal challenges, which I know Kate mentioned earlier, and really beginning to be more clear about our governance structure for that kind of integrated data system. I think this may have been a bigger task than many of our work group members knew it would be when they first signed on in the spring of last year. So Megan, can you just go back one slide and put the names of those folks up again? And I just want to say a huge thank you for their time and energy and brain power as we really slogged through some very complicated questions around Texas early childhood data. I think that's it. Did I miss a slide, Megan? Yes. Oh, thank you. I did ask Megan to include this slide because this is really just an outline of what the ESIDS roadmap will look like when we're ready to share, which is really momentarily the final roadmap, but it will really include, like I said, a kind of a definition of what this is even and what it looks like. Some like a bit of context and background about some ways that we've already integrated data, or some context for existing data initiatives that can help inform this next phase of data integration. We definitely did a lot of research and interviews with other states to better understand how their systems work and what best practices we can pull into Texas. When we reached out to stakeholders, we really worked to identify priority questions and worked across sectors and fields to understand if we can't do everything all at once, what are the most critical components that we want to tackle first. And then it will include some specific recommendations and considerations for our next steps, which include some of these specific questions that we want to answer or that we think an integrated data system could tackle. And I think, is this my last slide? This is my last slide. So I'm happy to answer any questions, but also want to sort of acknowledge that this is a place where we're going to do a bit more diving here in the next few weeks, and then certainly at our next Texas Early Learning Council meeting.
Thank you, Sarah. Kim, you have a question or comment?
Both. Not sure yet. We'll see what comes out of my mouth. So Sarah, I know we're waiting on the final report. What's the next step? Like, does anybody need to approve that? I know we've got money built into PDG for it. Like, what's the next steps of approval and process? And knowing this thing is much bigger than any of us ever anticipated, to keep the ball rolling.
I'm going to give a stab at this, Reagan, and then maybe you can help me if I miss anything. But I think part of the approval is really the ensuring the accuracy and correctness of the information that's included in the first place. But I do believe that there are some specific next steps listed in the recommendations, and they include things that we've already talked about, like identifying a governance structure for this kind of work, identifying key legal or statutory challenges, requirements, or already existing support for this kind of work. And I also think that one of the things that we did quite intentionally was try to align the kinds of recommendations with what may ultimately be sort of a IT or design process, so that as we think more specifically about what are the IT needs, which likely will be resource needs, I think it will allow us to better put some resource or budget ranges into some of the kinds of things that we're asking. We haven't done that in this roadmap yet, and that's in part because we haven't specifically identified the design components. That's really something that needs to be done in connection with DIR and our IT leadership. And so I think that would be part of the next step, is to begin to identify the budget resources required for some of the prioritized requests or recommendations.
2 follow-up questions. One, who has the final say on who is that lead agency? Is that the governor's office? Is that you guys all just draw straws?
I mean, that's a good question that I think is part of that governance conversation. I don't, because the data, there isn't a specific place where this would naturally lie. It's data that's shared among all agencies.
Right.
I think that's why it's been complex, and and part of what we have to work out. I don't think there is an answer to that question yet.
Okay. And then my second question is the work group meeting anymore, or are we officially
I think
fulfilled our requirements?
That's a good question too. I think we have officially fulfilled the requirements of that version of the work group, because our deliverable was to complete this roadmap outline and then turn in sort of a formal ESIDS roadmap. So we're sort of in the final phases of doing that. I think there will likely be more work to be done, and likely by a subsection of this Texas Early Learning Council. It may be that it may look similar to that work group. I think it's likely we'll have to bring additional stakeholders into that work group, especially I think we found that we didn't have a strong connection to the IT and design on our work group, as I think we pulled them in.
We need that now. Yeah.
But now it's time as we get more concrete. So I think that would be in addition to whatever the next phase is.
Great, thank you.
And other questions or comments from council members? All right. Thank you very much, Sarah.
Thank you.
Okay, we're going to move on to federal stimulus funding updates. And I am again going to turn it over to Kathy Arwood at TWC to provide a TWC update.
Hi, thank you, Reagan. So for federal stimulus funding at Texas Workforce Commission, we've got a couple of updates for you. One for the Child Care Provider Expansion Initiative. As a reminder, this initiative offers startup funding and also initial operating funding to help expand the availability of childcare, and the eligibility. And I'll say the eligibility through December 31st of 2022 included providers expanding in a childcare desert, and providers expanding infant only. So they may have just expanded by one infant classroom, but they would get additional funding for the infant. And then also employer partnerships. So providers that are working with a local employer to offer childcare in their area. We've heard some interesting stories about how those partnerships have developed and how employers and childcare providers are working together to support the workforce and then also support that childcare provider. Those employer partnership applications are still open through November of 2023. To date, well, I should say as of January 18th, we had 441 applications that have been awarded. And we've awarded over $10 million to increase capacity by over 20,000 new slots, including almost 9,000 new infant slots. So that's really exciting. I will say that the influx of applications came much faster than we anticipated. And so just due to our processes, getting that funding out has taken a little bit longer than we anticipated, but we are getting funding out. So everyone who's been awarded will receive their funding and hopefully very soon. So, we're look forward to sharing some additional updates as these applications continue to be processed. So while 441 have been awarded, there are still more that will be awarded that maybe in the process of some coaching and working through some, working through some hurdles to get their application actually awarded. Maybe they need to secure a site, things like that. So there are more that that are in the queue, and we've got everything posted online. I will share that link in the chat where you can find data online and then also more information at childcare.texas.gov. I also want to share that with the Child Care Relief Fund, in December, we did increase some of the provider award amounts by $57 million overall. So this was based on Texas Rising Star certifications and updated child care desert data. So where providers had not received the enhancement for those two, and they didn't qualify for it when they initially applied, we went ahead and updated their enhancement amounts. So added an additional $57 million. And that information has also been updated on our agency website. Again, I'll share that in the chat. And that is all for our federal update. Thank you.
All right. And just to be clear, the application deadline has closed for childcare expansion related to deserts and related to infant expansion. The application remains open for employer-connected childcare expansion. And Kathy, what is the application deadline now for the employer-connected childcare expansion?
November 30th, 2023.
Thank you very much. We also had an attendee asking about child care relief funding and whether child care relief funding criteria would change. Child care relief funding criteria will not change. The child care relief fund awardees have already been determined. And so if you have a new provider coming in, then their eligibility would be through that child care expansion grant. Are there any other questions or comments on this?
Reagan, sorry.
Yes.
I know you guys have a little bit more money to spend. When are we anticipating that going in front of the commissioners and knowing what that, I think got about 100 million left, right?
End of February.
End of February. Okay,
Is our
great.
target goal.
Thank you.
There's not much left, we hope. We are ready to get, we don't have a lot of time left. Keep in mind that most of the money has to be expended by the end of fiscal year 23. and only 1.7 billion of the 5.9 billion is available through FY24. So we really need to make sure that we get all of this money out the door and expended, because we don't want to lose any of this back to the feds. We want to spend it all. All right. So I believe that's all we have for federal stimulus updates. So I'm going to take us to our next item, which is our standing item on legislative updates, because the Texas legislature is back in session. So we'll continue to have this item posted. We don't have anything necessarily prepared for this. I do want to invite any of the members who have anything that they want to share right now about legislative session to feel free to do that. Stephanie, you often have thoughts on this, so I want to see if you
For sure. So thank you for the opportunity, Stephanie Rubin. So we're still analyzing the budget proposals, of course, and we will come out with a summary of what we think looks great, areas where there's some good steps forward, but probably, not enough funding, and many of us will be trying to meet what the agencies asked for, or in some cases, above what the agencies asked for, but what, providers and other community partners think is useful. So that should be coming out fairly soon. One thing, obviously, we're very excited about is a lot of momentum this session around making sure that moms have Medicaid coverage for a full year. And that is a clear priority of the House Speaker, who talked about it in his kind of speech as new speaker. And he talked about other, challenges that families are facing, including the cost of childcare, housing, transportation, all those things. So that was, a great recognition of all the work, kind of research and, advocacy, and the stories of parents and families, talking about their challenges. So I do think certainly there's going to be a lot of interest around healthcare, which is kind of why I wanted to mention it earlier, that, hopefully there'll be alignment with the Early Learning Council and talking about the health and well-being of kids and families, because there is a lot of interest in that in the legislature. And then I will defer to Kim to give any kind of update on childcare and so forth. But one of the other things we're very excited about is the agency, HHSC did have an exceptional item to support early childhood intervention programs, which is great, and would certainly, given that there's an increased number of babies and toddlers in the state, a growing population, and many ECI providers are serving way above their kind of contracted amount of money with the state, and obviously inflation, anything that would be viewed as level funding for any of our kids' programs, given inflation and population growth and so forth, would be considered a cut, in reality. So we're going to, make sure that there's some understanding about the need for more funding to serve more kids, improve quality, sustain providers, and shore up providers. And then the other thing, just in general, we're talking about is we have this incredible window of opportunity, which is, a flush budget. Obviously, there's a lot of competition for it, but if we are going to respond to some of the challenges that have been really serious of kids and families from the pandemic, this is obviously an ideal time for everyone to speak up and share their needs, and be part of the, policymaker education that policymakers do want. They want to hear what's happening in communities. So I'll stop there unless there's any questions.
Any questions for Stephanie?
The only other thing I'll mention that's coming out is, thank you to TEA. There was a bill last session that we worked on with a number of partners to have the state, the early childhood agencies work on a bilingual education strategic plan for young learners, and that plan has come out, which we're kind of reading and analyzing, and we will do a summary of that in addition. But we really appreciate, in particular, TEA and TWC and others who worked real hard on that. Thank you.
All right.
Reagan,
Thanks. And Kim?
Yep. So we're gearing up. So we've got one bill completely filed and through that process, SB 353, that looks at reimbursement rates based on reimbursement rates at the based off of your quality rating, not what you can charge families. So that one is working through the process, and there's lots more in the hopper. So lots that are in the Ledge Council and with members. And so we are working hard to get those through Ledge Council and get them filed and all that good stuff. So stay tuned because the next month will be a lot more bills dropping, and we'll have more meat to tell you as the months go on here. Reagan, are you guys going to talk about the 619 reports?
Yes, I'll give a short update on that in
Okay. All right.
the next section.
Okay. I think that's it. Just stay tuned. There are lots of things brewing. So make sure you're on all of our listservs.
Perfect. All right. Anyone else have anything legislative update? Okay, we're going to move on to agenda item 9, which is updates from Early Learning Council members. We have a few today. I'm going to start off with Lauren Gomez from the Texas Education Agency to share an update on pre-K guidelines.
Mm-hmm. And Lauren, I just brought you over to the panelist side. Feel free to unmute and when you can.
Okay, it took me a while to join as a panelist, so excuse that moment. So I just wanted to give an update on our rollout of the new 2022 Texas pre-kindergarten guidelines. So they are available now on our webpage, which I can share in the chat shortly. So the revisions to these guidelines have been a long process that included multiple focus groups with various stakeholders. Some of you may have been taking part in that. So we currently have a variety of supports in place to help with the implementation of these new guidelines. And that is set to be rolled out beginning with the 23-24 school year. So there are multiple versions of the document, including a comprehensive document that is also translated in Spanish and Vietnamese. We have streamlined versions that are for PK3 outcomes only, and then another for PK4 outcomes only. We also have side-by-side comparison documents, so you can see the revisions made from the 2015 Texas pre-kindergarten guidelines to the new 2022 guidelines. And we have a document for PK3 only and one for PK4 only. We also want to note something important with these revisions is that the 2015 version had a whole section in the introductory section that had a lot on learning environments and best practices. So that was removed in order to condense the document to focus on outcomes only, but we're taking that information and providing it as a separate resource, and we are tentatively publishing that in early spring, so there will be more information as that comes out. We also are providing lots of technical support through webinars. We recently held both the PK3 and the PK4. The PK4 webinar is available on our webpage, so you're welcome to look at that video and also the slide decks if you're interested in seeing those revisions. And then we will get the PK3 posted shortly in this upcoming week. We also have several office hours that are geared to anyone in the field who has questions about the new guidelines. And those registration links are available on our webpage as well. Are there any questions about the guidelines? Okay, if there's any questions, I will be sure to answer them in the chat, and I will move it on.
Okay, thank you very much, Lauren. We appreciate it. Okay, so next on the agenda, do we have the slide up for the school readiness dashboard? Perfect. Then I'm gonna turn it over to Stephanie to introduce David.
Wonderful. So thank you all for giving us the opportunity to talk a little bit about the dashboard. I think this is not the first time we've talked about it here because it's been in development, but it's now live and it's being used by lots of people, including legislators. We're very proud of it. David has done a great job, as is our team, really thinking through how to present the data to help educate people about school readiness. So I'm going to turn it over to David Fagan, who's the czar of our early childhood policy unit at Texans Care for Children. David, I leave it over to you.
Okay, thank you, boss. And good to be with you all. I'm very excited to talk to you about the dashboard. I know it's been a day of dense presentation, so I hope you're still sticking with us here as I know that many of you, throughout the last couple of years have provided us really essential feedback to make this dashboard possible. And I'm excited to give you an update. So Megan, I think you're in control of my slides, so I'll be asking you to advance, I suppose. But just as a reminder, the vision of this project has really been that we live in a Texas where all children arrive on the first day of kindergarten, ready to succeed and thrive for years to come. Obviously, that's directly aligned with the goals of this council and with so many other early childhood efforts in our state. And we really saw the dashboard as a value add in being able to really track our progress on that vision. You can go to the next slide. So this is my big picture summary. So if you only pay attention to one slide, please let it be this one. And really, it's a recognition that school readiness in early childhood must be a priority. That's something that Texans across the political spectrum have recognized. We've seen each session a bit more progress than the one before in really providing a spotlight on early childhood, on early literacy, on early education. And we're really excited to see that continue this legislative session. And experts agree, those who we've talked to across the country, that we need a more comprehensive view of school readiness. I know that a lot of us, when we hear the phrase school readiness, we conjure up images of, children being assessed on their vocabulary or, demonstrating their ABCs. And that stuff is really important, but it doesn't give us the full sense of what school readiness means and how policymakers and councils like this can really improve it moving forward. The other thing is that the dashboard data shows that we're falling short, whether that be falling short of our own goals for ourselves, or also just falling short when we compare ourselves to our neighboring states. And I'll walk through a couple examples of that here in a moment. And we hope that the data and recommendations that the dashboard has can really help us set goals and measure progress, which I know is something that this Early Learning Council has a key role in as well. So we're hoping the dashboard's a useful tool. Go to the next slide. So this is the need, not a surprise to anyone on this call, but we know that too few Texas children arrive at school with the strong foundations they need to succeed. The things that happen in children's first 5 years show up on that first day of kindergarten. We hear that from our kindergarten teachers that, there's an unequal playing field. And we know that in the last couple of years, that's gotten worse and worse. And so we're hoping that the school readiness dashboard, again, can help us measure progress and drive policy. So a little bit of a reminder about who was behind this project. We at Texans Care for Children really benefited from support from the Prenatal 3 Impact Center at the University of Vanderbilt. Many of you know Dr. Cynthia Osborne. Her team was really instrumental in providing some of the data that allowed us to do these comparisons to other states, helping us assess what's the most high quality data available. We had a diverse brain trust that included many people on this call. That really helped us think about how to visualize the dashboard and shape it in a way that's user-friendly. And we also benefited from some incredible philanthropic support, in particular from the Meadows Foundation, who provided some of the seed funding, as well as some of those other groups you see here. We could have many slides on all the people that helped make this possible, but these are some of those key folks. So I'm not going to go through all the little detail here on this timeline, but just a reminder, since many of you feel like you've probably been hearing about the dashboard for a long time, it's because you have. We started this in the fall of 2020 in earnest, and that's really when we, Stephanie, really put together a group of amazing Leadership Council and Advisory Committee members, from state legislators to chambers of commerce representatives to many people on the call here, who really helped us think about, what does this new idea of school readiness really include? What do we need to be tracking? And then since then, we've been really trying to operationalize this dashboard, think about the policy recommendations that will be included. And we launched it officially in November of 2022. So it's been a lot of work to get here, and we're excited that we finally have something to share with you for real. So if we can go to the next slide. So there are 5 categories of data. I know that 5 actually seems like it's very simple, but of course, each of those has several different data points within it. Sufficient household resources, adult-child interactions, good health and development, early learning experiences, and demographics. And I want to talk a little bit more about each of those individually and give an example of one of the data sets on the site. So if we go to the next slide, please. So demographics is the first one. We know to effectively address school readiness, policymakers need to understand and respond to the demographic realities of the population of young children. So that's knowing the number of children. It's knowing how many are living in poverty, which we'll get to more in a second. The number of annual births in Texas, so we can see where we're heading. And so our demographic information is not information, unlike the others that we're trying to see data improve or change over time. It's just essential to understanding who the kids of Texas are. So we go to the next slide. I'll show you an example of one of the graphics. So 1 in 10 births in the United States each year are children born in Texas. And I like to start out with this one because I think it's instrumental to understanding everything else, that this is a lot of kids. It has national implications, what we do here in Texas. And so understanding that 1 in 10 births in the United States each year is a child born in Texas, I think helps us ground the fact that there are a whole lot of young kids in Texas who need our support, and the work that this council and everyone else does to support it is really important. So we go to the next slide. So sufficient household resources is really about whether families have the financial security to really help promote positive brain development. We know that those who lack sufficient household resources face difficulties meeting basic needs like shelter, nutrition, and healthcare, and these things have a direct impact on school readiness. And so our dashboard includes some data on SNAP participation, how many children are living in near poverty. I mentioned that in the demographics section, as well as child hunger. And I'll show you a slide here, giving an example of one of the things that I think motivates a lot of us this legislative session. So this is, again, another example of a graphic on the site. And we see that SNAP, which is an effective policy tool, research shows, for addressing hunger, helping low-income families purchase healthy food. The children and families who are eligible for SNAP, 1 in 5 of them are not receiving it, almost 20%. Compare that to so many of our neighboring states, and you see we're really an outlier in this area. And that's because of policies we've set to be a bit more restrictive on accessing these services. It's about bureaucratic issues that we can overcome. And this is a theme that we saw throughout the dashboard process. We saw it on Medicaid, which I'll get to in a second. So, it's an example where this is not an inevitable problem. We can look at these other states and see we're a bit of an outlier. If you go to the next slide, please. So we know that adults have in a children's life, their parents, their grandparents have incredible influence and responsibility to help children nurture their children's healthy growth and brain development. And we have information on the site that we're able to track and compare on home visiting, child maltreatment when these adult-child interactions really break down, as well as access to daily reading, where parents have the ability to read to their young kids every day, which we know is important for school readiness. So if you go to the next slide, please. So another example of a different kind of infographic we have. So we see here that Texas children, when they endure maltreatment, such as abuse or neglect, this trauma and disruption really does harm their well-being. And we see that we do have a higher rate than the national average. As folks know, maltreatment can be driven by many things: untreated substance use, family domestic violence that has gone unaddressed, or mental health challenges in the home. And these are all things that have state policies that can help with. So again, I know this feels like a very individual thing sometimes, but there are state efforts that we can do and are promoting this session to help with this. So if we go to the next slide, I'll try to keep moving. Good health and development, as you can see, it has the most measures. And we know that's because there's a lot that goes into understanding a child's environment on good health and development. It requires healthy pregnancies, healthy births, and healthy babies. And so we have information on all of those things, as well as the ways the state can support children who might be experiencing developmental delays or disabilities, such as early childhood intervention. So if we go to the next slide, I will show you another example. Again, very similar story to SNAP. Texas is an outlier among eligible children under age 6 who are uninsured. These are Medicaid eligible kids. Almost 12% are uninsured. And so, we have some legislative recommendations to deal with this, ensuring that the enrollment process is easier for families. And I know that's a priority for so many on this call, to make that process easier for families that are eligible for these services. So we're going to keep on moving. Enriching early learning experiences is probably what people most typically think of first when they think of what school readiness is about. This includes things like access to early Head Start, access to quality childcare, participation in public pre-K. I will tell you also, just as Early Learning Council members, I worked very closely with the TWC team on this, the TEA team on this, and it was definitely the area where I struggled the most on the data we didn't have. And there were so many questions I wanted to answer and couldn't. And, we've made so many great efforts with childcare by the numbers over the years and things like that have really helped paint a clearer story on early childhood and early learning data. But we have a lot more to do, which is one of the reasons I'm excited about the ESIDS work and so much else. So just wanted to give that commentary. But if we go to the next slide, I'll show this is data we get from our friends at Children at Risk, Kim and the team there, that, over half of low-income Texas children live in a subsidized childcare desert, as, Kim's team has shared frequently. So that's certainly data we're taking to the legislature this session to ensure that they understand that over half of our low-income families, the supply and demand balance is out of whack, and we really need to ensure that families have access to the subsidized childcare they need for their kids to be school ready. So we're going to keep moving. How do we improve school readiness in Texas? We have over 50 policy recommendations on the site. If you go to the next slide. I actually had a legislative briefing this morning with legislative staff. We had around 30 staffers from different offices, and we talked about some of the data and the policy recommendations that the site has. We worked with a whole host of groups to ensure that the policy recommendations were evergreen, that this was not our 88th legislative session agenda. These are things that we need to be doing each session to improve. And we're excited to hopefully make some progress on those this session. I encourage folks to go through the policy recommendations because for our agency friends, there's lots of things in there that have implications for administrative work as well. So I would love your continued feedback on those ideas. So what's next? This is the final slide, I think. Next is we're sharing the data and policy recs with important decision makers, as I mentioned. We're advocating this session and beyond for the policies and programs to strengthen school readiness. And we're working on the local data, which is something that we know is really important to tell our story. And hopefully in our next iteration of the dashboard, it'll include local data. And then we're also planning for annual updates so that we can track our progress over time. And so I'm happy to take any questions. I hope I didn't take up too much time, but there's my contact information if you have any questions or feedback.
Becky.
Yes, my biggest thing is this is great. And I teach child development class. And I think that this is good to share with our students too, who are going through teacher ed programs at our birth through 5 or even the certification students, because oftentimes they might not be from communities that have a lot of issues like that, and they need to be aware. And so I think this is a great thing to not only just keep within the childcare community or the advocacy community, but also to share with students and that are going to work with children and families in their future careers.
Yeah, thanks for that, Becky. That's a great point and a good reminder too, that I think we have talked to some educators about this, and I think it's affirming for them to see all these different areas outside of what's happening in the classroom that they need to be aware of and think about when they're working with kids who come from different environments. So I appreciate that.
Any other questions or comments?
Stephanie, anything I missed?
No, you did a great job. I encourage folks, if they have specific questions or even suggestions, or want to leverage it and have their conversations about it in their community or with their coalitions, to just reach out to David, and we're happy to be helpful.
Good
Yeah,
stuff.
thank you, guys.
Very much. All right. Okay, so next slide. House Bill 619 strategic plan. So I'm going to give you guys a quick update on this. House Bill 619 passed last session and directed TWC to develop a strategic plan for the child care workforce and to consider input received from the House Bill 619 work group. We have to submit this plan every 3 years to the governor, lieutenant governor, and speaker. So you'll see links there. I wonder if we can drop those in the chat so people don't have to type out those long. We have 2 documents. The first is the document that the Texas Workforce Commission approved, which is the TWC strategic plan. It focuses on 3 different goal areas: supporting the child care workforce, supporting a pipeline of qualified child care workers, and examining opportunities to improve administration and oversight of the child care services program. This plan was approved on January 6th, and this plan was informed by recommendations of the House Bill 619 work group. We have also posted that work group on our website because there is additional information within that report that folks may be interested in. There are 3 goals, 6 strategies, and about 30 action items. Our report focused on those action items that TWC has the ability to begin working on. So we are starting to go through this plan to talk about implementation of those action items right now. And if you haven't had a chance to look at it, I encourage you to take a look at those links. And if you have any questions, you can let us know. Questions or comments? Okay. We're not going to see if other members have updates, and I do know that Megan Young with ECI has an update. Megan took over for Dana McGrath, and Megan should soon be a member of the Texas Early Learning Council representing ECI. Her application is going through the process. So Megan, I think you have an update for us today.
Yeah, thank you. I just had a quick update for ECI. We have recently added some medically diagnosed conditions that will automatically qualify a child for ECI starting this month. There's 2 diagnosis codes we added related to very low birth weight. We already cover some other codes, and so we're adding ones for 1,000 to 1,249 grams and one for 1,250 to 1,499 grams. We've also added karyotype 47, which is also known as XYY chromosome syndrome, as well as a deletion of long arm chromosome 12, which is also known as 12q21 deletion. We sent out a Gov delivery alert yesterday that had the actual diagnosis codes and a link to our diagnosis find webpage. If anyone wants some more information, I'm happy to forward that along. I know Megan has a copy as well. These diagnoses were added. They were recommended by some stakeholders, and we considered them with a panel of physicians. And ultimately, we decided to add them due to the conditions having a high probability of resulting in a developmental delay. So in other words, this does not really expand eligibility for ECI, but rather it's identifying children who are likely to qualify and helping these families get in to access services more quickly.
Stephanie.
Hi, Megan, welcome. to the council. I just wanted to thank HHSC for this process of reviewing, the recommendation. And also, it's just important, I think, for people to understand that one of the goals in the ECI program and among providers is to, as Megan mentioned, sort of get families in as early as possible if there's an identifiable need. When kids enter at age 2, as opposed to when they're 6 months, that's a lot of missed really important time for babies and toddlers to develop. So this is going to be this change, right? Again, it's not new eligibility. It's just hopefully will help more kids enter earlier so that they have better outcomes. And so we're really grateful. So it's wonderful.
All right, any other questions or comments on ECI? Thank you, Megan. We look forward to you being an official member soon. I have another update from TWC. I want to see if any other members, though, have any updates that they want to share with the council. I'm not hearing any. Okay, so I did want to let you guys know we've had a lot of discussion about data today. And in fact, David Fagan referred to Childcare by the Numbers. That's a web page that we created to try to start pushing out data. There's actually a statute that says that every other year we're supposed to submit a report to the legislature that has a lot of data in it. It's our effectiveness of childcare report. We actually did just complete that for submission to the legislature, but most of the data in there is available on Childcare by the Numbers, which we update every quarter. And one of the things I wanted to let you guys know is that we've received a lot of input from folks about additional data that people are interested in. I'll just tell you, we have a long-range plan on data to develop more interactive data dashboards rather than these static charts that link to Excel files that we currently have now. But it's going to take some time to get there because the agency is building out a big data warehouse and all of these, I call them Tableau reports, but those more interactive reports. In the meantime, we are continuing to update our Childcare by the Numbers webpage. So we are adding in additional data on license capacity of programs, CCS enrollments by age, by TRS program, the number of families served, the unduplicated count of children, which is higher than the average number of children served per day. We're trying to add information. I call it our market penetration. What % of providers have one or more children referred in their program? And I'll tell you, there's a chart in the House Bill 619 report, a pie chart that breaks this out. It actually shows you what % of programs have CCS referrals and how big are those referrals in light of their total capacity. And if you look at the report, I'm gonna try to do this off memory, but I may not remember this, but it's something like 20 or 30% of our programs that work with us have fewer than 20% of their kids enrolled coming from CCS. So we touch a lot of providers, but providers generally are serving many other private pay kids than they're serving CCS kids. So we're trying to get some of this data published on Childcare by the Numbers as well. We are also working to get data posted on board waiting list information. We are going to have a new case management system that rolls out. We're aiming for like October of this year. And when that system rolls out, we will have waiting list data that will follow a standardized policy for how that data is collected, reviewed on an ongoing basis. In the meantime, we're still using the data that's maintained locally, and they just tell us every month how many is on the waiting list. So boards manage those waiting lists differently right now. So the data that we post isn't necessarily apples to apples across board areas, but it is data that we have. So we're going to go ahead and get that information out there. Right now, we have over 60,000 on the waiting list across the state. It differs by board areas, but we know that there's been some interest in that as well. So just want to let everybody know that we're continuing to push information out on childcare by the numbers, and we have these long-range plans. The other thing, there's a state data portal, and childcare regulation has posted their information on regulated facilities. We usually get a few requests for the, it's called the ACF 801 report. It's a report that we have to send to the feds with child level information. We are now posting that to the state data portal. So if folks are interested for research purposes, for that kind of stuff, that information is out there on the state data portal. So just want to provide those few data updates to the council. And with that, I will open it up once more to see if there are any updates from any other members, if you thought of anything you want to share. And if not, we're going to go to our last agenda item, which is upcoming early childhood events. And Kim, you have an update for us.
Finding the mute button, really finding the mouse. Yeah, so to keep on your radar for right now, next week we're having our first quarterly meeting of 2023. So we will have updates, sludge updates. Allison will be here from TWC to join us. There's a link there. I'm sure Megan will drop it in the chat because she's been on top of that all morning. And then the second one is our save the date. We will have an early childhood day rally day at the Capitol on March 21st. So that is a Tuesday. We will have from 10 to 12, we will be at the South Steps. So if you come one, come all, bring your families, bring your children. We'll have South Step stuff, activities, and then we'll also have time in the afternoon to go visit your legislators. So save those dates and come join us.
All right, thank you, Kim. Those are all of the updates that we received prior to the meeting. Any additional events that members want to share? Okay. So with that, we are at the end of our agenda. I want to see if council members have any additional information or comments. Megan has put up our next meeting, April 21st, 11 a.m. to 1 p.m. Okay. Council members, thank you again for joining us, and to all of the members of the public and those who gave presentations today. We always thank you. We've got a lot of work ahead of us, both with the session and with this new PDG opportunity. So we're really looking forward to the work that we're going to embark on in this calendar year. It is 12:53 and we are closing this Early Learning Council meeting. Thank you, everyone.